I'm Alice Lorch. I'm the Program Director for the Harvard Ophthalmology Residency program at Mass Eye and Ear, and I want to thank you for considering our program. So first and foremost, we're really looking to train excellent ophthalmologists. So those are clinicians and surgeons. We're looking for people who have demonstrated excellent clinical skills in their medical training and have really shown some commitment to patient care. We want to take those people and really give them all the resources we have to train them to be excellent clinicians. We have a vision for our residents, and we want to find people who also have a vision to share with us and to support them as they progress.
Our residency program is really strong. We have world-class leaders in every aspect of ophthalmology, and as a resident you get to work with them. We don't bring them out for interview day and then hide them away in a closet when you're actually seeing patients. So you will, for good and bad, get to work with them.
We have a very thoughtful surgical training program. So over the course of 3 years, we really think about stepwise surgical training. We get our junior residents in the OR from the very first day, learning steps of different surgeries, and that sort of progresses over the course of 3 years, such that halfway through their second year, they're doing full cataract cases, they're doing full subspecialty cases, and we think that sort of thoughtful approach to surgery is very important. So the foundations of our surgical training are in our surgical training wet lab. We really have a truly world-class wet lab where there are 8 stations that are set up with phacos. We can have our whole classes in there together at the same time training. It's also set up for AV so that you can do video recording of your training. Proctors can walk around and they can watch what the residents are doing. That's sort of the foundation of how we teach surgery. We really believe in the importance of simulation, and our residents have access to that 24/7.
I like to say that Mass Eye and Ear and Harvard Ophthalmology is where the future of ophthalmology is made. When you look at the great advances that have come for ophthalmology, whether it's treatments for macular degeneration, diabetes, new treatments for corneal problems, the advent of gene therapy, really that has arisen out of work by faculty members at Mass Eye and Ear and Harvard Ophthalmology. So it's an exciting place to be. We get wonderful trainees, and as a faculty member, it's just great to be stimulated by these bright young minds. I would say it's a very friendly place where people are curious and want to learn and are passionate about their work.
So there are many things that make Mass Eye and Ear really special and unique. One is, first of all, our size. So we have a large training program. We have 8 residents every year. In addition to that, we have a large faculty. So if you come here, you'll have subspecialists in every single area that you will learn from, and multiple in each area. So you can learn different techniques from them and different sort of styles of taking care of patients. I think you can't talk about Mass Eye and Ear training without talking about the emergency room. So we have one of 3 24/7 ophthalmic emergency rooms in the country. And as a result of that, we get referrals from all over the area and even internationally. Patients come into our emergency room and with a really diverse amount of pathology. And that's something that's really special about our program. And any resident that you talk to who's gone through our program will talk about that as sort of the foundation of their training.
My strong belief is that people that want to have a family should have the support and encouragement to do so. And in our department and in our institution, we've made great efforts to make sure that everybody feels supported in those decisions, and that it's a seamless process through residency, fellowship, or as a faculty member.
Mass Eye and Ear is a place where our residents can really construct their own path, and residents come to us with a lot of different interests, and we try to support them in that. So certainly we have a lot of research in a variety of different things, so ranging from basic science but also to clinical research, people interested in things like healthcare disparities. In addition, we have a lot of people who are interested in global health, both on our faculty and our residents. And our residents have opportunity to do a rotation their senior year in Yerevan in India. And this is a relationship that we've had for a long time, and is a way for our residents to really understand healthcare delivery in a different setting. So the way that they see ophthalmology provided in India is different than what they see in Boston, and they have the opportunity to learn new surgical skills there, but also learn a new culture and a new way of providing healthcare. And that's a relationship that's been important and long-standing, and the residents have really enjoyed. Chief resident, who after finishing training spends a year with us as a junior faculty member before they go on to fellowship. This is something that's also unique to Mass Eye and Ear, and that person works both as a surgical and clinical teacher, so spends a lot of time in the wet lab with the residents, spends a lot of time training them in the OR, is also the director of the ocular trauma service, so we see a ton of trauma, and our senior residents do primary trauma cases with the chief resident. The chief resident also does a lot of cataract teaching with the first and second year residents. And then above and beyond that, this is a person who acts as a mentor for the residents across the course of their year. So it takes the junior residents, teaches them the skills of ophthalmology, but also mentors them in the course of their training, advocates for them, and is someone who is a go-between between the residents and the faculty.
The advice I would give to applicants is to think about what matters to you in terms of how you like to learn, whether you like to be in a large residency class or small, obviously city versus rural, what approach to teaching matters to you. And as you go through the interview process, you want to try and glean what a program is like in those terms and see whether it's a good fit for you so that you will be able to follow your dreams and follow your career.
So Mass Eye Near is a place that has endless opportunities for our residents who come to train here. We're looking for people who come from diverse backgrounds with diverse interests, and we want to provide them with the resources that we have to make them leaders in the field. So I'm just thrilled that people are interested in learning more about our program. I hope that they come and utilize all the resources, the webinars, the things that we are providing in the upcoming months. And it's a challenging season to learn everything you need to know to make a decision about your residency. And I encourage people to take the time to view our resources as they are, but certainly also reach out if they have questions. We are more than willing to answer questions to make people comfortable with their decisions and to provide any more information that they need.